Well, it's National Autism Acceptance Month, obviously, and we are bringing not only awareness but acceptance to the world. Now, the numbers continue to increase. Have you seen the latest numbers?
Yes. So, and a small note on acceptance versus awareness. So, we're really delighted that so many people have adopted acceptance over awareness. That was something that was started many years ago. And I think the neurodiversity movement has had a really great role in pushing forward autism acceptance. So, we appreciate that. In terms of the statistics, yes. So the latest CDC statistics, which are still from a few years ago, is 1 in 36 individuals now being diagnosed annually in the United States. And that is up from 1 in 44, which was previous, and then 1 in 56 was previous. And as we know, it keeps increasing. And if I'm honest, I actually think that statistic is still a little bit low. I think the numbers are higher than that. We have a wonderful diagnostics program at Firefly, and what we have seen is we've seen a huge increase in the number of females in their late teens and early 20s who are being diagnosed on the spectrum, and a lot more adults. And the thing I should point out about that 1 in 36 people with autism statistic from the CDC is that is based on 8-year-olds. So if people are diagnosed after the age of 8, they're not included in that statistic. So we basically kind of already know that statistic is actually higher than what it seems.
What they're showing.
Yep.
Well, I'm shocked that it said that more than 7,500,000 people, according to the research conducted by the CDC, that's 1 in every 100 children are diagnosed on the autism spectrum disorder.
Mm-hmm. Yeah.
I'm just floored. I mean, is it in the water? What? There's got to be. Well, I guess there don't have to be, but I thought there's something that. Why is everybody all of a sudden being diagnosed?
Yeah, it's a great question, and one that I definitely get relatively frequently. I think that the big piece of it is education. You know, I come from a very rural village in the middle of Ireland. And, you know, when I was growing up in the 90s, not to age myself, but when I was growing up in the 90s, people didn't talk about autism. Nobody knew what it was. You know, looking back on some friends that I had in school, I can think now, yeah, that person was definitely on the spectrum. But nobody knew about it and nobody was talking about it. So I think one key piece here is education. People are much more aware. People know the signs to look for. Pediatricians are more aware. There's a lot more really, really highly qualified diagnosing clinicians and clinical psychologists who are much more able to diagnose individuals. And I think the sensitivity of the diagnostic process has gotten better. I am very passionate about equity when it comes to autism diagnoses, and we know that women are under and misdiagnosed a lot, but the diagnosing clinicians know that now too. So, you know, historically, let's say 15 years ago, boys were being identified a lot more with autism than girls because the diagnostic processes were directed more towards male behaviours or the male phenotype, let's say. But that's changing, where clinicians are now saying females don't present the same as males. They have a lot of a better ability to mask. They can present more socially, but that doesn't mean that they're not on the spectrum. So I think the sensitivity is getting better, the education's getting better, parents know more what to look for. I think, personally, autism was always there. People just weren't being diagnosed.
And they just didn't know about it. Like we said years ago, not many people knew very much about it except Rain Man.
Exactly.
That's about the only thing people knew about, and now it's a whole new world.
Yeah, and, you know, talking of equity across diagnoses as well, this last CDC report was the first time ever that Black and brown children were being diagnosed more than white children. And that has never happened before in the history of autism diagnoses.
Really? And what was the typical age at that time?
8, so 8-year-olds.
Wow.
Yeah. And now, on one hand, right, I always look at things from a kind of a critical mind.
Sure.
On one hand, you're thinking, well, this is great. You know, it's great that there's obviously more access to diagnoses in historically marginalised groups. But then you look on the other hand and you go, but why now more of those children? Is it more of a propensity to diagnose people with something? So I look at that with a bit of a critical lens. So I think it's just important to always look at statistics not as the absolute truth, but it's part of the story.
Part of the story. And everybody has a story, don't they?
Yes.
Very good. How long have you been with Firefly Autism?
11 years, which is wild. So I moved from Ireland to Colorado for a job at Firefly. So my America story is literally landing in the United States, going to Colorado and pulling up outside Firefly Autism and thinking, this building is tiny. This can't be right. But we have since moved to a much bigger building. But yeah, 11 years, and I've been the CEO for the last 2.5 years, which has been just such an honor.
Wonderful, wonderful. Now, you offer many services for anyone on the autism spectrum.
Yes, across, people say, tell me what you do at Firefly. And my response is, how long have you got? Because it's a lot. So yeah, we have everywhere from even pre-autism, right? So our diagnostic services actually diagnoses for everything, not just autism, any kind of learning differences or, anything else that individuals might be seeking help for. And then all the way from early intervention through to school age programs, home and community-based services, and then all the way into adult groups, social support groups and things like that. And then one lesser known thing about Firefly is we also do a lot of community training. So we have a good example is we've got a training contract with Denver International Airport. I don't think they'd mind me saying that. And so out at DIA, they're doing an amazing job in their Centre of Equity and Excellence in terms of inclusivity. So we do some training for them on autism acceptance and other pieces. And then the last piece is that we work with the Chickasaw Nation in Oklahoma. So we are one of the primary providers of behavioural health services and training for the Chickasaw Nation. And that one's special to me because my husband and my husband's family are part Chickasaw. So it feels pretty special to be able to do that.
Well, that's wonderful that you're reaching out into the community and doing all these wonderful things. And DIA, one of the largest airports. Mm-hmm. Wow.
They do a great job. I have to give such props to that team over there. And I'll say Nicole Jones specifically, they do a wonderful job.
Excellent. Well, let me ask you this. It's about that time of year, isn't it? Time to laugh yourself blue again. Okay, so tell us about the Laugh Yourself Blue. It's a big gala, right?
It is, yes. And I'm delighted that you'll be coming, Tree.
Yes.
Yes, it's our biggest fundraising gala of the year. It's on April 25th at the Sewell Ballroom at the DCPA. We're expecting upwards of 600 to 700 guests this year. I know. We're 2 weeks out, so my stress levels are actually going down, which is great because everything's basically done. But this is a crucial fundraiser for us at Firefly. A lot of our programs are either pro bono services, like we do scholarships one time every month for a family for diagnostic services. Lots of our adult groups are covered entirely by us. So we are also a very intensive program in that we give a ton of support for any of the learners in our program. So it's really, really important for us to continue to be able to fundraise to do the things that we need to do and to be able to support our community. And as I mentioned, this is one of our biggest fundraising galas of the year. So if anybody wants to support, they absolutely can. And people can find all the information on our website.
And the website is?
www.fireflyautism.org.
Very good. Thank you so much. I look forward to the big gala. Laugh Yourself Blue. That's a good laugh there.
Yes.
Laugh Yourself Blue. Well, go ahead.
We also have Matt Eisman, who is of Ninja Warrior fame. He is our comedian. So we're very excited for that as well. And you will be laughing a lot, I'm sure.
Well, I look forward to much laughter on that evening. I certainly do. Dr. Kelly, thank you so much for coming down and being part of the KUVO Community Connection, a Colorado where everyone feels seen and heard.
Thank you so much, Tree.